Good morning. June is Migraine and Headache Awareness Month. Victor Bruce, a physician assistant with St. Peter's MS and Headache Center in Albany, joins us live to talk more about the causes of migraines and the latest treatments available. Good morning.
Good morning.
So let's start off with, what are the most common types of headaches?
Well, the most common type of headache is tension type headache, but that is also one that is less severe or less bothersome to most people. So in actuality, the most common type that seek attention for because of the symptoms is migraine.
And how common are migraines?
Migraines estimated to be a prevalence of about 12 to 13% of the population, not just in the United States, but worldwide. So if you look at the United States, 13% of the population is probably close to 40 million people.
Wow. And all headaches have certain defining criteria. So what are the defining symptoms of a migraine?
Well, migraine is actually the disorder. Headache is a symptom of the migraine. And that's where a lot of people say, well, it's just a headache. Well, it's not. It's a complex brain process. The criteria for migraine set by the ICHD committee is an episodic headache that meaning it comes and it goes, with an estimated time 4 hours to 72 hours. With that, the criteria, you need two of the following characteristics. It's a one-sided unilateral headache. It has characteristics of pounding and throbbing. It's at least moderate and often severe. And it makes a person want to stop activities, or they know activities are going to make them feel worse. With that, you need one of the following symptoms. It makes you nauseated, or makes you vomit, or makes you sensitive to light and noise. That's the criteria, but many people have multiple other symptoms that go along with the headache.
Are there certain triggers for a migraine?
Triggers, there can be multiple triggers. If an individual is lucky enough to find a specific trigger that they can avoid, that is very helpful. Some of the common triggers are sleep deprivation. See this in younger people who go off to college. The weekends, they're changing their sleep patterns and they get more headaches. But shift workers, other people with sleep disorders, weather changes. Some of the people can feel when the barometric pressure is changing before even the weathermen on TV can tell. Alcohol, red wine has always been a noted trigger, but almost any type of alcohol in an individual can be a trigger. I've had people, certain types of beer were a trigger. Certain foods, prepared foods, things with nitrates in them like hot dogs and that sort of thing. But the majority of people, it's multiple things that attack them at once or set off their migraine, and not just one isolated trigger.
And why is it? Some of these things, like you mentioned, alcohol. What is it about alcohol or sleep deprivation that triggers these?
They have an effect on the neurochemistry of the brain, and most likely stimulate areas that are generators for the migraine, or stimulate areas. An area of focus is the trigeminal nerve complex and the areas in the brainstem where the trigeminal nerve work or function or give their input to. And alcohol, certain foods, they have effects on blood vessels. They probably cause release of various chemicals, inflammatory chemicals and other things, enough to tip the apple cart over and make migraine start.
And can children suffer migraines?
Oh, certainly. Some some kids as young as, well, almost infancy, have been diagnosed with migraine. I'm not sure I would be able to determine that. I don't see kids that much. But they display their symptoms differently. Often a shorter headache, respond to sleep, but they're debilitated when they have the symptoms. A lot of times there's nausea and vomiting, and life is disrupted during that period of time.
And will children typically outgrow migraine?
I don't know if they really outgrow them. They're always susceptible, but it seems like boys seem to settle down as they get into puberty, where women, females, probably because of hormonal changes, there's an increase. So the ratio goes up 3 to 1, females to males, until you reach later life and women start to reach hormonal changes again with menopause.
And what about treatments? What treatments are available?
When we look at setting up a treatment plan for a patient, we discuss both acute treatments and preventive treatments. That takes into account the patient's needs, the patient's other ongoing medical conditions, how many headaches they're having. If they're having less than 4 or less headaches per month, then they may be able to improve their quality of life with just taking acute medicine that takes the headache away rapidly, and they can get back to normal function. Between 4 and 6 to 8, you really want to start thinking about preventive treatment. In an individual who's got 4 or 5 days per month where they're taken out of their life or work, they often will want to consider preventive treatment. 8 and above, then you really should be looking towards the possibility of putting a person on preventive treatment. Acute treatment, there are things that are approved or have good evidence. The Triptans are probably the most beneficial of the migraine medicines, and they were made specifically for treatment of migraine acutely. In most people, they're well tolerated, but some people do have difficult to tolerate side effects, some lightheadedness, tingling. Some people even complain of initially having increased headache. What we call the Triptan side effect is a kind of a tight or hot feeling that rush up into their upper chest and anterior neck. And I always make sure I warn people about that so they don't panic. Mm-hmm. It doesn't seem to have any detrimental symptoms or side effects to it, but it can be scary. Non-steroidal anti-inflammatory medicines such as naproxen, diclofenac, they've been found to be very useful. They come in various forms, liquid caps and chewable tablets, and diclofenac has a form that's a powder that you mix in water and drink, which has been approved for migraine treatment. We try to avoid things like narcotics. They have their own problems, and they are not very effective for migraine treatment. And one that we tend to avoid as much as possible, I almost never prescribe it, is a combination with a barbiturate, butalbital, and either aspirin or Tylenol and caffeine, because that has not had much in the way of proof of benefit in migraine, and it has a potential of transforming episodic to chronic migraine rather profoundly. From the standpoint of preventive treatments, up until recently, we have never had anything that was made specifically for migraine prevention. We've used medicines that were used for other reasons, such as antidepressants, anticonvulsants, antihypertensive medicines. And individuals were found to have improvement in their migraines when they were on these medicines, and further studies allowed some of them to be approved by the FDA for the treatment of migraine. Most recently, about a year ago, a little over a year ago, we had the first of the migraine-specific medications developed, and now we have 3 that seem to be very effective, and the side effect profile, at least to this point, seems to be extremely good. These are what are called monoclonal antibodies that block either the receptor of a chemical called CGRP, calcitonin gene-related peptide, or the chemical itself, so it can't stimulate the receptor. The 3 that are available now are primarily given once a month by a self-injected subcutaneous approach. One of them can be given 3 injections every 3 months. And the future, there are other medicines similar on the horizon, and some newer medicines with different ways of working to be developed or approved. But these seem to be extremely good medicines.
And these are, again, aimed at, prevention. And so for the person who maybe isn't suffering chronic migraine, but suffers them occasionally, is there anything preventive-wise that they can do to, prevent the onset of these debilitating headaches?
Well, they can avoid triggers if they can identify those. Sometimes things like improving your sleep, good sleep hygiene, which means no caffeine or liquids late in the day, not watching TV, or the younger people on their computers and the media, the devices and stuff, and try to regiment their time of sleep, going to bed at the same time, getting up at the same time. Exercise often has a beneficial effect on all sorts of pain problems, but particularly headache. Staying hydrated. Dehydration can bring out migraines in many, many people. Eating regular meals, whether it's an effect of hypoglycemia or other causes. Some individuals need to have at least a little snack every few hours, and that seems to help. Relaxation, meditation, and in areas where you have somebody who can teach biofeedback, those are all sorts of methods that help with warding off or decreasing the migraine, and sometimes help in prevention.
What about as far as relief of symptoms, non-prescription, things like acupuncture or pressure points, any of those that have had, proven benefit?
There's been reports with acupuncture where it has shown benefit, but there's not overwhelming evidence one way or the other. It's somewhat difficult to do randomized controlled studies on something where a patient feels a device or a needle or something similar, and so you have to set up a protocol where they feel that they are getting the true treatment. That makes it a little more difficult and those things. Same with acupressure, but some people respond quite well to these modalities and they are safe.
And so, just to wrap it up, if somebody is suffering from migraines, again, what is the criteria for when you should call, or alert your doctor or see a specialist?
One, I think if it is affecting your quality of life, you're missing time from work or social functions, even if it's 1 or 2 times a month, and whatever you take doesn't work, you should contact your practitioner and say, or seek additional treatment, something that's specific to the treatment of the migraine. The diagnosis is not that difficult, but there are a lot of things that are mimics of migraine, so you have to be cautious of those things. But appropriate treatment sometimes is all needed to get people through each attack.
Great. Thank you so much, Victor Bruce. Appreciate you taking the time to talk about this today with us.
My pleasure.